Thank you, Christophe, for your two questions. We try to allow only one. Dr. Simao, you have the floor.
I'll start with the production capacity, because this is quite an important question, and because we are looking at two things. First of all, we are looking at the vaccines that have proved to be safe and effective, and that are also quality assured, right? That's one side. The other side, it's how fast they can be manufactured around the world. And WHO has put together, at the request of Costa Rica, a proposal for a COVID technology access pool, where we have on one side a call for increased sharing of knowledge and technologies, including technology transfer, and on the other side, also a call for increased voluntary licensing through the medicines patent pool. The World Health Assembly is also discussing it, will be discussing in May, a resolution on increased local production capacity across in different countries. And this is very important right now, because what we see is that we need, this global crisis has shown us, is that we need to diversify the supply chain. We need to make sure that we have increased capacity in different parts of the world. Right now, it's very concentrated in some countries and with some companies. So this is a venture that goes beyond COVID. But the CETA provides a platform where voluntary mechanisms can be put in place to help countries and to increase the possibilities of technology transfer between different manufacturers across the world. I think this is going to be important. It is important for vaccines, but it's going to be important also for any therapeutics that proves to be safe and effective against COVID. Thank you.
The second question, Dr. Aylward.
Sure, thank you very much. The question was, how safe are the deals with COVAX in terms of the products? I think, as most of you know, and we announced, if I remember correctly, last Friday in the DG's presser, the COVAX facility has now got secured and guaranteed volumes of, deals, pardon me, for over 2 billion doses of vaccine for this year, and then we have options on doses, over 1 billion doses additional. So how safe are those deals? Well, the deals are safe. The question is, how safe are the volumes? As you've seen, a number of companies recently announce making vaccines is hard, and there's unpredictability in some aspects. This is a biological process. You know, the projections that companies made about how many doses, they were pushed very, very hard. They tried to maximize their doses, but that depends on many, many factors, whether they'll be successful in doing that. And some companies in some places have had problems with what we call the yields from their products, which ultimately tells you how many doses you can get of the vaccine, and they've been lower than expected, meaning that they've had to announce lower amounts. So the deals are safe. The question always is the volumes. Will we get to the volumes that are very, very ambitious? And that will be the challenge as we go forward. And this is why, to the point that Mariangela was talking about, you know, COVAX and the ACT Accelerator, much of it has been a fantastic success. The ability to repurpose the international health architecture and move so quickly on an end-to-end global solution for something like as challenging as this, taking a unknown disease and having a vaccine to reach billions of people in a year is simply extraordinary. But as you look at that end-to-end solution, we had a great research capacity around the world that really kicked in. We've got great procurement capacities through Gavi, and then working with UNICEF, PAHO, and others, and great distribution networks. But right in the middle of that, there's a critical piece of the pie, and that's the ability to scale up those products very, very quickly to scale. And we're paying a bit of a price for the fact that there's been a contraction in global producers of vaccines for years. It's a difficult difficult business to be in. And as we go forward, part of what we're going to have to look at is take a hard look at how do we solve that and make sure that we can move more quickly. Because in the middle of a crisis, trying to just, like Mariangela was saying, move the technology to another company or someone who's never made a vaccine is very, very difficult. These are hard products to make. So this is going to require a longer-term solution as we go forward.
Thank you. Let's go now to Colombia. Andres Gil from NTN 24. Andres, are you with us?
Hola, ¿me escuchan bien? Buena tarde.
Buena tarde. Go ahead, please.
Gracias, gracias. Mi pregunta es, ¿ya hay aprobados envíos de vacunas por mecanismo COVAX para países de América Latina? ¿Era posible que hoy, 29 de enero, hubiese un anuncio sobre ello? En caso afirmativo, ¿cuáles serían esos países que recibirían los primeros envíos de vacunas COVAX? Y si hay cantidades o fechas para esos envíos. Gracias.
Sorry, I was getting tired of hearing my own voice and hoped someone else would take a question. So, indeed, you're correct. What's happening today, the COVAX facility is working on what they call indicative allocations. So they're looking at the products that they have in the pipeline for the next quarter or 2 quarters, and these are primarily AstraZeneca products, products from the Serum Institute of India, et cetera. They're looking at the volumes that have been confirmed by the company, and then they're working with WHO and the allocation mechanisms that Mariangela runs to do what we call an indicative allocation, to try and give countries a picture of how much of that vaccine they can expect and when they can expect it, based on 2 critical factors, though. When the regulatory processes will be complete, we have promised the world, we've promised the people of the world that we will only supply products that we can absolutely assure the efficacy, the safety, and the quality. And that takes time. It takes a lot of data, a lot of review to go through that, and that's what's happening right now. So if that part goes properly, which we're anticipating by early to mid-February for these products, and then the second thing is the volumes. Are the companies going to have the volumes? And as you know, some companies are having challenges, so that is going to affect potentially what those volumes actually look like. So the goal this afternoon is to provide, or this evening, pardon me, or in the next day, what would be called indicative volumes, or indicative, and that will help the companies, or sorry, countries to really begin planning then. All of a sudden it's very, very real that you know the baby's coming, and it's time to start planning and getting everything in place, those parts of the readiness that aren't ready. So that's to help countries plan and get their readiness in place, and with the hope that then these products will start to move in February. In addition, they're also looking at a potential first wave activity that involves the Pfizer product that was announced last week. So these are the pieces that are hoping to communicate as soon as possible to countries.
Thank you. I would like now to invite Jamie Keaton to ask the next question. Jamie, Associated Press.
Thank you for that. And nice to see you all again. There was an important decision that came from the European Union today about restrictions of the possibility of the export of vaccines from the bloc. We've talked, Dr. Tedros talked about vaccine nationalism. We're hearing about getting to the front of the queue. We're talking about worrying trends. I would really like you to please try to address that specifically about how concerned you are. Is that a sign of the vaccine nationalism that you're talking about? And how concerned are you about that decision? And in particular, what is the specific impact that it could have on countries that are waiting for the AstraZeneca vaccine? Thank you so much.
Thank you, JB. Dr. Simao.
Hi, Jamie. I think we had already answered a similar question before. So, of course, there is always a lot of concern when any country decides, or any bloc decides on restrictions or export bans on what we call global public goods. And what was mentioned before today already was that it's particularly concerning because the global supply chain is so diverse now, and it's so how to say, fragmented. Products come from everywhere in the world, right? So you may have active ingredients for vaccines, for example, coming from China, that will come for the production in Europe. The vials will come from somewhere else. So it's such a globalized chain of products that it's very concerning when any country or bloc starts to put restrictions in the movement of what are actually public health goods, right? We all need these vaccines to be equitably distributed. And for that, we need that the flow of the ingredients and the flow of the material that will be used at the end of the line, you know, and that will allow, they go even to syringes because it goes from the production, the R&D production, and then the production of the actual vaccine to the vaccine being injected in a real person, right? And all this has a line of products that comes from everywhere in the world. So it's actually, these are measures that don't benefit global health, don't benefit any country specifically, and actually can hamper the plight and the global efforts to ensure there's equitable access to these products.
Yeah, maybe further, just to add another point. You know, I think we, at a time like this, always need to take a step back, right, and make sure that we approach this in a way that is going to ensure everyone gets as much access as possible to these products. And of course, right now, there's tremendous frustrations, there's disappointments, there's been a lot of excitement about the vaccines, a lot of promise. And companies have been pushed very, very hard to maximize the amount of products that they can make, and ultimately, some of those promises and ambition are falling a bit short. Now, that doesn't mean that things will stop, of course. The vaccines will continue, but they're not going to be at quite the levels that they needed to. But, you know, if you look at the counterfactual, right, companies are trying to make as much vaccine as possible, and they are trying to honor the obligations that they have in terms of those products. And then they're further stressed by the fact that we're making demands to go further than those obligations and make sure these get shared everywhere. And what concerns us the most in a situation like this is that ultimately it's the most vulnerable countries and often low-income, low-middle-income countries that suffer the most in any situation where we end up with trade restrictions or barriers. And those countries are already incredibly disadvantaged right now, as you're seeing in the rollout of these products, and we're trying to rectify that. And we certainly wouldn't want to see anything further complicated, because ultimately the higher income countries, they find ways around, they find solutions to these sorts of problems, but the damage that can be done to others along the way is what concerns us the most.
Thank you. Let's take a last question from Michael Busirkif from CNN Opinion. Michael, can you hear me?
I can hear you, Fadila. Can you hear me?
Very well. Go ahead, please.
Thank you for taking my question. Sorry, it's a bit of a double barrel. As you know, elected leaders, public officials are key to disseminating public health messaging in a pandemic. But over the last few weeks, counted elected and appointed officials have been caught out going on vacations or non-essential travel, either domestically or beyond our borders, in violation of the same advice or regulations which they themselves have either drawn up or espoused. I think this is very important to hear from WHO, especially because so many people have been adhering to the guidelines. But what would your words of advice or peer advice be to these individuals, public officials who have violated the public trust and gone against their own guidance? And just quickly, and forgive me, but because the DG spoke of vaccine nationalism, Canada has secured access to more vaccine doses per capita than any other country in the world. They've struck deals with for about 414 million doses, or about 9 doses per person. And you've already talked about the shortages and the challenges facing COVAX, but is there an issue here with fairness in your opinion? And should Canada release some options rather than betting on every vaccine production horse, so to speak? Thank you.
Thank you, Michael. Dr. Van Kerkhove will take the first part of your question.
Thanks, Videla. Thanks for the question. I mean, I won't comment on individuals. I mean, I think the bottom line is that all of us have a role to play. And all of us need to be following the recommendations with the common goal of ending this pandemic. You know, this pandemic has had a tremendous impact on all of our lives. We are living through probably one of the most challenging situations that most of us will have ever dealt with. Although if we look to our loved ones of older age, they've also been through very difficult times. And we need to stay the course. There are actions that all of us take every day that will have positive consequences or negative consequences. And this is tough. We know that a year plus into this, we're tired, we're exhausted, we want this to be over, but we also have a role to play. We are working with populations and people all over the world to listen, to engage, to understand what are the barriers to compliance. And some of these are really legitimate concerns. People have to make a living. They have to leave their house to make a living, to feed their families. Others, there are inconveniences. And we need to do what we can to minimize our exposure to this virus, especially in areas where it's circulating. We've seen a number of countries that have brought transmission under control, which are having sporting events outside and are living their lives because they have brought the virus under control. We will get there, but we have to make the right decisions every single day to minimize our exposure, and all of us have a role to play. So going back to, you know, barriers for compliance, we listen and engage with many different groups, with different ages, with people all over the world to really understand what are those barriers. I think we have a lot more to do in this area of work and understanding behavior and understanding the social determinants of all of this, and working through that. So when we say to stay home, people can stay home. Governments can support them in doing so. But we need everyone's help. So do what you can. And this, you know, we have health workers who are online, who have contributed to this press conference today, who may want to comment on this because they are out and about every single day, putting their lives at risk. And we, as non-health workers, need to do what we can to minimize our exposure, to not need health care, to not overburden an already overburdened healthcare system and keep them safe. So thanks for the question, but bottom line is we need to put in the work and we all have a role to play.
Thank you. I think that was the last question. Huh? Yes, I know. Dr. Edward, do you want to?
Sorry, I think I'm getting the second barrel of your question, Michael, which was about countries that have contracted doses and the ability or of those countries to share those doses. So when we look at the early part of this crisis, before we knew which vaccines might work, there were many deals set by many, many countries across many different products. And while we were trying to consolidate some of those deals, in the end of the day, the many deals, what they did was they really did spur a lot of innovation by a tremendous number of companies. It resulted also not just in innovation, but also a lot of expansion of manufacturing capacity and building out capacity for those products. And of course, at that time, these were bets that many of the high-income countries were making, not just Canada. It was a wide range of countries. But ultimately, they drove what we're now reaping some of the benefits of in terms of many products proving to be successful vaccines. We heard just yesterday and again today some encouraging news about new products on even a new platform as well. So all of that very, very encouraging. And by November of December, if we just walk through the history a little bit, November of December of last year, it became obvious that a number of these products were going to be successful. So the COVAX facility, working with the EC, with Canada actually, with other countries, tried to establish what we could now call the principles for dose sharing with the COVAX facility. And what we've done is created a mechanism through which countries that do find that they have excess doses contracted, meaning that they have enough products products that they know are efficacious, that go beyond their needs, or even before they go beyond their needs, they're able to share those doses through COVAX, because that's the mechanism to make sure the most equitable distribution of those possible. So we're at a point today now where many countries are looking at that, and despite the challenges now around supply, around uncertainties, around the variants as well, they're looking at the map of vaccine distribution around the world, and they are trying to now plan when they can begin to share doses. Because like the Director General said, his concern a couple of, I believe it was last week, he laid out was that as countries now vaccinate their healthcare workers and vaccinate their older populations, we need to make sure that healthcare workers, like we saw today, Sarah and Harriet, that they're getting vaccinated before we move into the non-risk populations in other countries. So really the challenge is the one that the Director General laid out in his speech, right? Can we unite and collaborate across all of the contract holders on these products, all of the companies, to ensure that every country within 100 days at the beginning of this year are able to be vaccinating at least their healthcare workers and their older populations. So that's the goal, and we're trying to create the mechanisms to make sure that's possible. We believe that is the situation today. It is possible to do that, but it is going to take still another step up in collaboration internationally to achieve it.
One last comment in the sense that, because we are seeing two movements, we know about these big bilateral deals last year, right? We've been discussing this a lot. But we are seeing a movement also of private sector trying to buy directly from the industry. Right? And we see also an increasing number of small bilateral deals from different countries in the past month. And we've been alerting that this is a movement that it's counterproductive, and it's also not necessary, because the COVAX facility is about to start the distribution of the vaccines as soon as they become approved by WHO through the emergency use listing. So I think this is important to highlight, because we are seeing that companies are some of them have already, we know that some of the private sector has already said no to buyers that are not public, for public use, for private use. So these two movements needs to stop, actually, because we have a global facility that's becoming operational quite soon. Countries will be receiving doses of the vaccines that have been assessed by WHO or an stringent regulatory authority. So things will be normalizing in the next few months. So that's an important, besides the donations that Bruce has already mentioned, but I think it's important to think that this is countries are going to receive vaccines. Don't panic.
Just very briefly, the DG spoke about a year ago the announcement of a global public health emergency. And he outlined at that time what we were going to need: a comprehensive strategy applied relentlessly, because at that time we didn't have the perfect tools. We had tools, and those tools were built around case detection, contact tracing, public health and social measures like physical distancing, hand hygiene, and other things. We've learned so much about the virus in terms of better and more available diagnostics, better ways of treating and saving lives, and we've seen fatality rates drop when health workers have the time and the space and the training and the PPE and the availability of medical oxygen and other things, and we can see death rates plummet in that situation. So we've not been helpless in this, and we are not helpless in this. So I would hate to think that our fears around vaccines create a helplessness again, that feeling that we can't be the masters of our own destiny. And I think the DG has been absolutely persistent in calling us all to use every single tool in the toolbox, to do it all. And I just don't want us to get, the vaccines are an important issue. The controversies around vaccine are important that they're resolved. It's important that we make progress. But as Bruce said, There's been remarkable scientific progress to get where we are. There's some serious teething problems, there are huge equity issues, but they have to be resolved. But that doesn't mean we're helpless. So we need to get back to business here, together, ourselves, scientists, governments, communities. And we need to apply the knowledge that we've learned systematically and comprehensively and answer the call that the DG has made again and again. We have to redouble our efforts and just not get distracted by the controversies and just solve the problems, one step in front of another. And I think today we do that in honour and in service of those frontline workers who joined us today, to put them in a position to do the best job they can, to control transmission in communities and to save lives. And I believe we can do that, and we are doing that. We just need to bring vaccines online in a more stable and predictable way, and that's just what the team here are trying to do and what the partners in the ACT Accelerator and COVAX are trying to do.
Thank you. Dr. Tedros, final words.
Thank you, Fadila, and thank you to all our colleagues who have responded in a very powerful and effective way. And thank you also for those who have joined today, especially to Harriet and Sana, our respect and appreciation. And we're here to support you, and we hear you very clearly, and we will continue to support you. Then on the vaccines and other products, I think we have to look back back into history. If you take HIV/AIDS, there were medicines available, of course, several years after the pandemic was raging. But then when medicines were available in high-income countries, in rich countries, they were not available in developing countries. And the medicines actually arrived in developing countries almost a decade later. I don't think that's a good history, it's bad history. Then second, it was during the epidemics of H1N1. There was vaccine. The vaccine was purchased by wealthy countries, and vaccines arrived actually in the developing world when the pandemic was over, or the epidemic was over. So it's a choice. Do we want to repeat the same history now? I don't think so. If we hoard vaccines and if we're not sharing, there will be three major problems. One, I said it will be a catastrophic moral failure. And two, it keeps the pandemic burning. And three, very slow global economic recovery. So it's morally wrong in terms of arresting the pandemic. It wouldn't help, and it wouldn't also bring livelihoods back. Is that what we want? So it's our choice. And I hope we will choose the right things. For now, what WHO is saying is, if countries can vaccinate their health workers and elderly and people with underlying health conditions, it's enough. So let's have the world, at least all countries, have this first, and then we can move to the next. And this is a small world now, a village, a global village. And we need to help one another. It's only through solidarity and unity that we can defeat this pandemic. It's not through me-first attitude. I thank you. And see you in our next step. Presser, thank you.
Thank you, Dr. Tedros, and to our participants, including our guest. I would like just to remind you that we will be sending you the audio file plus Dr. Tedros' remarks just after this press conference. The full transcript will be available on the WHO website. Have a nice evening and weekend. Thank you.